what we want. And this is interesting. And reduce concentrations of pro-inflammatory cytokines. Now, cytokines are these hormones or these chemicals that one cell uses to communicate with another cell. So one cell communicates with another cell using these chemical cytokines. And some cytokines promote inflammation. So good levels of vitamin D is going to reduce the concentrations of pro-inflammatory cytokines. So if you reduce the amount of pro-inflammatory cytokines, in other words, you reduce the amount of inflammation, which is great. Because in COVID-19, if we remember our alveoli diagram like this, these hollow bunches of grapes, these alveoli, where the air goes in and out. So that's the bronchiole, the air goes in there, we breathe it out there. And the oxygen goes from there into the blood, and the carbon dioxide goes from the blood back into the air to be breathed out. Now, part of the problem with COVID-19 is that people can develop ARDS, acute respiratory distress syndrome. And that is basically an inflammatory condition. So what happens is the alveoli and the airways become inflamed. And they become inflamed because of these pro-inflammatory cytokines. So they become inflamed. And then, like when you sprain your ankle and it gets swollen, fluid comes out. So we get fluid collecting in there. And that means we get what we call consolidation and infiltration in the lungs. They fill up with fluid and therefore they don't work. Therefore the people get